Namaste all. Myself Dr. Reji from AVP Research Foundation. I would like to speak about genetic counseling. Nowadays, we all know there are many diseases which are being transmitted through hereditary, or it can be a non-hereditary diseases. So, for knowing what is a hereditary disease and what is a non-hereditary disease, we need the basic idea about genetics. What is genetics? Genetics is nothing but it is a branch of biology concerned with the study of gene, genetic variation, and hereditary in a living organism. And now, what is counseling? Counseling is nothing but it is a process of communicating between two or more persons who meet to solve a problem. So someone comes to us with a problem saying that they have a particular disease, and we want to know what is the solution for it. We want to know where first, before knowing, we want to know what is the solution for it. For that, we have to know whether it is a hereditary or a non-hereditary disease, and what is the mode of inheritance it is. Okay, so for that, we have to see the mode of inheritance. So we know what is the mode of inheritance. That say mode of inheritance can be an autosomal dominant or an autosomal recessive or an X-linked dominant or an X-linked recessive disorder. Okay. So what is the autosomal dominant disorder? It is nothing but it is an altered gene in a dominant gene located on one of the non-sex chromosome, which is called as autosomes. We all know we have 23 pairs of chromosomes, out of which 22 pairs are said to be as autosomal chromosomes and one pair is said to be a allosome or a sex chromosome. The sex chromosome can be either an X chromosome or an Y chromosome. X chromosome, it denotes the females, whereas Y chromosomes denotes the males. And we have to know which is the dominant and which is the recessive one. Okay. And counseling usually has specific therapeutic focus such as prenatal, pediatric, psychiatric, or it can be a cancer genetics. Now we have to know what is genetic counseling. Genetic counseling is nothing but it is the process of investigating individuals and families who is being affected or who is at risk of a genetic disorder, and we have to help them understand and adapt to medical, psychological, and familial implications of genetic contribution to the disease. Genetic counseling also involves providing education about inheritance and the testing options, disease management, and prevention. Next slide, please. The American Society of Human Genetics defines genetic counseling as a communication process which deals with the human problems associated with the occurrence or the risk of occurrence of a genetic disorder in a family. Smith defines counseling as a process in which the counselor assists the counselee to make interpretations of facts relating to a choice which he needs to make. Next slide, please. Genetic counselors are nothing but they are the health professionals with specific education, training, and experience in medical genetics and counseling. Now we want to know who needs counseling. So if you think you have a genetic condition or you have a child with a genetic disorder like cystic fibrosis or sickle cell disease or a birth defect or a cleft lip or a cleft palate. So it can be the chromosome, it can be a numerical or a structural variation in the chromosomes. So chromosomal disorders are said to be numerical or structural, in which the structural disorders can be either a deletion, duplication, translocation, inversion. Okay, so deletion is nothing but it is a part of a chromosome. You have two arms of chromosomes. One is the short arm or one is the long arm of the chromosome. So if there is a deletion in either one of the chromosomal arm, we say it as a deletion pattern. So duplication. Duplication is nothing but the chromosome gets duplicated. Inversion, it gets inverted to a 360 degree. And translocation is either as an arm of a chromosome or a part of a chromosome gets translocated to some other chromosome, you say it as the translocation. And numerical aberrations or numerical abnormalities can be, a chromosome can be added to either one of the chromosomes. Among the 23 pairs of the chromosome, a chromosome can be added. For example, you can say it as trisomy 21, which is a Down syndrome. Okay. And Turner syndrome, which is a 45X, where it is one chromosome, X chromosome gets deleted. Another one, we can say it is Klinefelter syndrome. So one X chromosome is being added to it. So if there is a chromosomal disorder or a hereditary cancer, we go for a genetic counseling. So 2 or more pregnancy losses, or if there is a miscarriage, then you can have a genetic counseling. And if a child is being born with, if you have a stillbirth or a baby who is being died, then you go for a genetic counseling. Next slide, please. Aim of genetic counseling. Coming to why do we need a genetic counseling and what helps out of it? How does a genetic counseling help a person? Aim of genetic counseling is nothing but it is to support the individuals in their ability to make an informed decision regarding genetic testing and implications of such testing. Counseling usually has a specific therapeutic focus such as prenatal, pediatric, psychiatric, or cancer genetic counseling. Next slide, please. And what do a genetic counselor do? We work as a member of a healthcare team and we assess the risk of genetic disorders by researching a person's family history and evaluating their medical records. And we provide support and information to help the person make a decision about the testing. And we interpret the results and medical test and data, explain them the possible treatments and preventive measures. And we genetic counselor work with nurse geneticists, and they also play an important role in the counseling part by giving some decisions, what to do and what not to do, and they give psychological support also. Now coming to the indications, next slide please. Coming to the indications of genetic counseling, family history of a known or a suspected disorder, known carrier of a genetic condition. Usually, females are found to be the carriers. And we can see the females, what is a carrier? A carrier is no one but they suppress the disease among themselves, and when they come to the next generation, it gets expressed. And consanguinity or a blood relation, if there is a fetal structural abnormality, or we can see in an ultrasound, and if there is any known teratogenic exposure, then you go for a genetic counseling. And if there is a recurrent pregnancy loss or a stillbirth or a neonatal or fetal loss with structural abnormalities, then you go for a genetic counseling. And patient requests for additional information regarding genetic test options. Next slide, please. What are the steps of genetic counseling? Now, following are the procedures which has to be followed. First, we have to know the history of the patient, and you have to have a proper record of the history, and then you have to say whether they are a consanguineous or not, whether they are blood related or not. And now coming to the family history, you have to know about the siblings as well as the relations also. Next slide, please. Now coming to the phases of genetic counseling. What are the phases of genetic counseling? First is the assessment phase. Second is the diagnostic phase. Third is the analysis phase, communication phase, referral and support phase. Coming to the assessment phase. Next slide, please. First is the pedigree. Pedigree is nothing but it is a family tree which shows the parents and the offspring across the generation, as well as who is having a particular character. Pedigree of an individual family are used by genetic counselors, which help them to provide information to the family who may be at risk of various disorders. I can show you a pedigree. Next slide, please. Now you have to see who is consanguineous, whether the couple is being related or not to one another, because there is increased chance of their children to be affected with the condition who is having a recessive pattern. Exposure during pregnancy. If a woman has taken any medicine or they had exposure to harmful substances from the environment, such as chemicals and toxins, then there is a more risk of a disorder. Coming to the techniques. Next slide, please. Coming to the techniques, how we do a pedigree chart. This is the pedigree chart which I have shown, which we usually make to find out the risk pattern. So by doing this pedigree chart, we'll come to know what is the estimation of risk as well as the mode of inheritance of the genetic disease. As I have told, it can be either a hereditary or a non-hereditary disorder. So what are the hereditary disorders? We can say it can be either an autosomal dominant disorder or an autosomal recessive disorder or an X-linked dominant disorder or an X-linked recessive disorder. Apart from it, we can say either it is a mitochondrial disorder also. So these are the patterns of inheritance. So coming to what is autosomal dominant mode of inheritance, we have to see whether it is a autosomal dominant or not. In an autosomal dominant disorder, the altered gene is said to be a dominant one, and it is the one which is located on the non-sex chromosomes, which is said to be the autosomes. So, for example, we can say it as Huntington's disease. This Huntington's disease is nothing but it is a progressive disorder, progressive breakdown of the nerve cells in the brain. So, what are the symptoms of this? It can be difficulty in concentrating, it can be a memory loss, or it can be a mood swing. Okay. And now coming to the next mode of inheritance, it is an autosomal recessive mode of inheritance. So what is autosomal recessive mode of inheritance? It is nothing but you can inherit two changed genes. That is, it can be done by a mutation. Okay. You can get it one from each parent. So in case of autosomal dominant mode of inheritance, that is 50% or equal chance of being affected. Both males and females are found to be equally affected. Whereas in case of autosomal recessive mode of inheritance, they'll be carriers and they will have only 25% chance of having unaffected child, or they can be having an affected child. Next mode of inheritance can be X-linked mode of inheritance. Okay. And for example, for autosomal recessive mode of inheritance, you can say it is sickle cell anemia. There are many disorders, that is sickle cell anemia, cystic fibrosis, Tay-Sachs disease, or diseases which comes under the autosomal recessive disorder. Coming to X-linked dominant disorders. So X-linked disorders are nothing but, so we say that males have one X chromosome and one Y chromosome, or then they are found to be the dominant persons. So X-linked disorders, they come from the sex, they can be, the abnormal gene can be the X chromosome. Okay. And it can be from the males. It can be from the males. For example, you can say it is Rett syndrome. It is an X-linked disorder, dominant disorder. So coming to X-linked recessive disorder, it is nothing but it is a genetic condition which is associated with the mutations in the genes on the X chromosome. So in this X chromosome is carried by the male also. The male carrying such a mutation will be affected because he carries only one X chromosome. A female carrying a mutation in one gene with a normal gene on the other X chromosome is found to be an unaffected one. Okay. For this X-linked recessive disorder, we can say it as Duchenne muscular dystrophy, that is DMD, which is commonly found now. And next we can say that hemophilia is also an X-linked recessive disorder. Next slide, please. So next step, what is the technique for finding out a chromosomal abnormality is karyotyping. By doing this karyotyping, we can find out what is the chromosomes can be examined. The procedure, this is done by a geneticist to find out the chromosomal abnormality or whether it is a numerical abnormality. Next slide, please. Next is the procedure which is done is amniocentesis. Amniocentesis is the test which is being done during the pregnancy time itself. It is done to check if the baby has a genetic or a chromosomal disorder. We can do this amniocentesis to check out for Down syndrome, Edwards syndrome, Patou syndrome. So when is this amniocentesis done? This amniocentesis is performed during the week 14th of the pregnancy, 14th to 18th we can say. So this is done during the period of 14th to 18th week of the pregnancy, in which we take the amniotic fluid of the patient to find out this amniotic fluid. It surrounds the womb, and we take out the fluid to find out the disorder conditions. Next is the next slide, please. Next is the chorionic villus sampling. Chorionic villus sampling is a test which is being offered during pregnancy to check if the baby is having genetic disorder or not. But this test is being done in the 13th or 14th week of pregnancy, and where we take out the placenta. So this is not advisable. The amniocentesis is found to be better than the chorionic villus sampling. Next slide, please. Next phase is the analysis phase. Analysis phase, in which we take a literature search or review of information, and we consult the experts, and we compile the information and determine the recurrence risk. Next is the communication phase, in which we can communicate the result and risk to the counselee and his or her family, and discuss the natural history of the disorder and the current treatment options. And we have to make them understand about the facts of the relevant hereditary disorders, and we have to know how to manage this disorder. Next slide, please. Coming to the referral or the support phase, you have to refer the individual to a genetic specialist for further investigation, and you have to support decision that is made. You have to support for their decision that is being made by the counseling, and you have to give them psychological support, and you have to follow up and evaluate for when they come for the next visit. Now, next slide, please. Coming to the types of genetic counseling, it is of two types. It is prospective and retrospective. Prospective is nothing but it is a wider application to cover a number of recessive defects. It identifies individuals for any particular disease by screening. For example, you can say it is sickle cell anemia. This sickle cell anemia, it is a preventive disease. And coming to the retrospective, it is done after contraception, pregnancy, termination, and sterilization. Next slide, please. Next is application of genetic counseling. Coming to the application of genetic counseling, there can be prenatal genetic counseling, pediatric genetic counseling, adult genetic counseling, and cancer genetic counseling. Coming to prenatal genetic counseling, next slide, please. Prenatal genetic counselors, they work with the individuals, couples, or families who have increased chance of having a child with birth defect or a genetic condition. During pregnancy, if a baby is found to have a birth defect or genetic condition, you are being referred to for the prenatal diagnosis by a genetic counselor. The counselor, he will help you by The expecting parents understand the medical information, what to expect and how to prepare and what is the next option for that. So prenatal counselors also help many families who do not have an increased chance of having a child with birth defect or genetic condition to understand prenatal screening and testing options. Procedures such as blood test, ultrasound, and AFP, alpha fetoprotein test, is also done during the prenatal genetic counseling. Next slide, please. These are the tests which include in the prenatal prenatal test, which is ultrasound, maternal serum AFP, that is the alpha fetoprotein, chorionic villus sampling, and the amniocentesis. Next slide, please. Pediatric genetic counseling. Coming to pediatric genetic counseling, families or pediatricians, they seek genetic counseling when a child has the features of an inherited condition. Any child who is born with one or more defects, such as mental retardation or dysmorphic features, has an increased chance of having a genetic syndrome. For example, we can say it is Fragile X syndrome, as we all know. What is Fragile X syndrome? Next, coming to adult genetic counseling. Next slide, please. Adults who seek genetic counseling are the persons who, in which, when a person in the family decide to be tested for the presence of the known genetic condition. When the adult is exhibiting the symptoms of an inherited condition, then they go for a counseling. The birth of a child with obvious features of genetic diseases, they lead to the diagnosis of a patient who is mildly affected also. Even if the child is being mildly affected, then we go for a counseling. Next slide, please. Cancer genetic counseling. While most of the cancer is said to be inherited, we have two types of cancer. One is found to be a hereditary disease and one is found to be a non-hereditary disease. So for breast, ovarian and colon cancer, we can say it as genetic disorder, which is a hereditary disease. And we can say whether it is inherited or not, we have to go for a counseling. Next slide, please. Now we have to see what is the role of nurses in genetic counseling. They guide the couple through the prenatal diagnosis. As I told, the prenatal diagnosis includes ultrasound, alpha fetoprotein test, amniocentesis, chorionic villus sampling. Then apart from that, we do the karyotyping also. Help the parents make the decision in regard to the abnormal prenatal diagnostic results. And we have to assist the parents who have had a child with birth defect to locate needed service and support. Providing support to the family with the emotional impact of a birth defect. And we have to coordinate with the services of other professionals such as social workers, physical and occupational therapists, and psychologists, as well as dietitians. So these are the role of the nurses who are involved in the genetic counseling. Thank you.